Hello, welcome back to the Fraser Health Online Cardiac Rehab Education Program. My name is Dominique, and I am a registered nurse working in the program. Today's focus topic is intimacy after a heart event. Hopefully, you have already viewed the introductory presentation so that you have an overview of the sessions and format that are provided for your learning purposes and self-management needs. This program has 9 sessions in total, including the introductory class. Presentations do not need to be viewed consecutively, but instead, you can pick and choose what best fits your schedule and learning needs. Be sure to view each topic for the most comprehensive understanding of your cardiac condition. My topic today is intimacy after a heart event. Heart disease can impact your relationships. Caring communication is very important, and it can have positive or negative effects on your intimate relationships. One example of a negative effect is that family members may become more protective and vigilant. A positive example is an increase in your closeness. There are misconceptions surrounding sexual activity, and some people may refrain due to fear of causing another heart attack. It can be nerve-wracking for someone who's had a heart event to feel safe and comfortable with resuming sexual activity. But the fact is, among people with heart disease, the odds of suffering a heart attack within 2 hours of intercourse are roughly 1 in 50,000. All couples who experience a cardiac event have questions about sex not often asked. Sex will get the heart pumping, but usually no more than a brisk walk around the block or a climb up 2 flights of stairs. One way to examine the amount of energy used during sexual activity is with METs. METs are a measure of metabolic use of energy. When you are at rest, you are only using 1 MET of energy. For sexual activity, it is usually between 3 to 5 METs. This would compare to doing yard work, or mowing the lawn, or walking briskly. And there is no evidence proving one sexual position is safer than another position. Usually it's a situation of comfort. And sexual positions may be initially affected by open heart surgery. It will be hard to support your body weight on the arms for the first few months. Another example is after an angiogram, the groin may be a bit more tender than usual. Intimacy and exercise. It's been shown that regular exercise 3 times per week may reduce the likelihood of adverse heart events during or after sexual activity. Physical complications. There may be a temporary decrease in sexual desire and function due to fatigue, depression, the side effects of medications, or pain. Depression and anxiety are very common after a heart event. Fear and worry decrease sexual function. Please talk with your doctor to find alternative medications. In 85% of clients, depression and reduced desire pass, never becoming a long-term problem. But if impotence continues after 3 months, treatment is recommended. What is erectile dysfunction or impotence? Erectile dysfunction or impotence is the inability to achieve and sustain an erection suitable for sexual intercourse. The condition is not considered normal at any age. Premature ejaculation, infertility, or low sex drive are not the same as erectile dysfunction, though one or more of these conditions may be associated with it. It is estimated that erectile dysfunction affects about 1 in 10 adult males on a long-term basis. A much more common problem that affects most men at some point is the occasional failure to achieve an erection. Occasional failure can occur for a variety of reasons, such as from drinking too much alcohol, or from extreme fatigue, or following any acute illness, such as a heart event. Failure to achieve an erection less than 20% of the time is not unusual, and treatment is rarely needed. Failure more than 50% of the time generally means there is a psychological or physical problem, or combination of both, that requires treatment. When to resume sexual activity? A majority of patients can and do return to normal sexual activity within 3 months after a cardiac event. Some doctors recommend to abstain from intercourse for the first 2 to 3 weeks, not because it's dangerous, but because it takes the pressure off both partners to perform. As physical health and confidence return, the sexual problem may disappear. If sexual difficulties persist, ask a doctor for a referral to a clinical psychologist or sexual counseling service. Don't misinterpret your body's normal responses. Heart beats faster and harder, breathing is faster and harder and more labored, skin is flushed and moist. These are normal responses to sexual activity, not symptoms of heart strain. And these are also normal responses to exercise in general. Concerning symptoms, if you become severely breathless, or if you have excessively fast or irregular heartbeats, or if there is a feeling of pressure, pain, or discomfort in the jaw, neck, arm, chest pain, or stomach. If you experience any of these symptoms, you will need to seek medical attention. Guidelines to follow. Choose a time when both are rested, relaxed, and there is low stress. Wait 1 to 3 hours after a meal. Take medications as prescribed by your doctor. Start slowly. Foreplay as a warm-up is important. Slowly increase the heart rate and body temperature. These guidelines would also be similar to when you exercise. What to do if symptoms occur? Tell your partner. Reduce the workload. Rest and take medication. Nitro spray. If nitroglycerin worked when having symptoms, use nitro spray before sex next time. But if you are not accustomed to using nitro spray, sit down or lay down as you may feel dizziness. If you are living with angina, nitro spray may be recommended before exercise as well. And if symptoms are not relieved by nitroglycerin, or if they come back, seek medical help. And with Viagra, avoid if you are taking nitroglycerin products routinely. The reason for that is that Viagra, or sildenafil, was actually meant to be a blood pressure lowering medication. When it was tested on college-age student volunteers, it was found to improve erections. So if you are using a nitro patch or using nitro spray routinely, using Viagra may lower the blood pressure as well as the effect of blood pressure lowering from the nitroglycerin combination. If there are questions, view other presentations for further in-depth cardiac information, or consult your healthcare provider to have specific questions answered. Thank you very much.